Here is
105.5.
Accessing 105.5. One station, all the hits.
105.5. Splash.
Understaffed and overworked. The dire state of Oyo State's primary healthcare system. Oyo State's primary healthcare system is virtually teetering on the brink of collapse. In this in-depth investigative report, Isaac Femiojo reveals a disturbing reality: how critical staffing shortages are hampering healthcare delivery across the state. In a survey of 6 primary healthcare centers, both newly upgraded and long established, it was discovered that most facilities were managed by a lone matron and a handful of nurses. On arriving at primary healthcare center in Oyo State, their stark realities seem same. They all caught the pictures of chronic understaffing, which leaves the vulnerable population of health consultations at significant risk, with overstretched health workers struggling to meet the needs of their communities. Some of them lamented that, despite promises of improvement, the healthcare crisis in their facilities persists.
There is shortage of manpower in every sector. Even this is health. We have short staff, not only here, all over Oyo State.
Upon visiting 6 PHCs across the state, the findings were remarkably shocking. Both urban and rural facilities were predominantly managed by a single matron, acting as the officer in charge, supported by just 1 to 2 nurses, seen as a nag undermining every foundation of public health in that state. At the Adifashe PHC in Dogo, Akpata, Ibadan Southwest Local Government Area, in particular, a facility serving over 710 patients monthly has only 1 heavily pregnant government-employed health worker. She looked overworked, almost to the point of breakdown. I also saw that she had just 1 laboratory technician assisting her, as their situation cuts the picture of a broader systemic issue facing the state's healthcare system. In its entirety, the situation in Oyo State's PHC centers are a clear case of staffing deficiencies. Total health facilities breakdown. The scenario was forlorn at Akeke PHC Basharun at Ibadan Southwest Local Government Area when I got there. Aside it being a very old facility with no modern touch, only 1 matron, 1 desk officer, a few ad hoc staff, and volunteers serve a community of over 3,000 people. I met the facility deserted when I got there, as I was told that most residents would rather seek medical care elsewhere due to the number of staff available. Okebola Primary Healthcare Center in Ibadan Southwest Local Government is another old facility where just 1 matron, 1 nurse, a few ad hoc staff, and volunteers served a community of over 4,500 people from different ethnic groups. Even at the renovated facility of Adifashe Primary Healthcare in Dogo, Akpata, Ibadan Southwest Local Government Area, I met only 1 matron, 1 lab attendant, 1 ad hoc staff member, and a few volunteers, struggling to cater for the healthcare needs of hundreds who had come to seek medical attention. Saja Isaliora Primary Healthcare at Ogbomosho North Local Government was not different. It has just 1 matron, ad hoc staff, and a few volunteers to attend to the needs of those who had come for healthcare. By the time I got to Ayite Primary Healthcare in Ibarapa North Local Government, it was no longer a shock to see just 1 nurse employed through Basic Healthcare Provision Fund intervention and a few volunteers and scores of health seekers. The renovated Eleyele Primary Healthcare Center, Babalegba, in Ibadan Northwest Local Government facility had slightly enhanced scenario with 6 government-employed workers assisted by 3 nurses serving over 700 patients monthly from 33 different communities. Making efforts to document the crisis firsthand, I encountered a series of distressing accounts. Mrs. Adeleke Abimbola, a nursing mother at Eleyele Primary Healthcare Center, shared a touching narrative of her traumatic childbirth experience at Akpate Primary Healthcare in Akpate, attributing to its severe understaffing.
I have intention of living there, but I labored there for two days. When I didn't see anything, I have to go to one private hospital. The first day I got there, I got there around 9. They said by 12 in the midnight. But unfortunately, they said it's not your time. till 2 days, sha. So I have to move. It was the same one nurse that to another hospital because I have just limited time. So I have to rush to a private hospital. So I delivered there with CS. There was one doctor that came around just to put fingers.
Reflecting on her ordeal, Mrs. Abimbola questioned the necessity of purchasing induction materials that were ultimately unused.
I was even thinking they were in this. They bought the syringe there, but they didn't. They said they can't do that. Why are they not selling?
Commenting, Mr. Karim Nuruddin, chairman of the Ward Development Committee at Akeke Primary Healthcare Center in Bashorun, Ibadan, painted the challenges faced in managing nighttime emergencies due to limited operating hours and staffing shortages.
Wọ́n find more staff. Wọ́n fi lè máa ṣe shifting lálẹ́. Wọ́n find more staff. Wọ́n fi máa ṣe shifting lálẹ́. Kò ṣiṣẹ́ alẹ́. Gbogbo gbìyànjú àwọn matron tó wà ń bí àwọn aláṣẹ bí yìí kí wọ́n fi lè máa ṣe shifting. Pàbó ló já sí. Wọn ò rí ṣe. Báláboyún bá lóyún bí tó bá lálẹ́ ń ṣe Ìbàdàn North láìsẹ̀ máa gbé lọ lóru bí bíbá ṣe dáa tó.
Mr. Nuruddin also expressed concern about security, noting recent burglaries at the PHC. Also lamenting Mrs. Esther Amo, officer in charge of Eleyele Primary Healthcare, acknowledged the level of resourcefulness required to manage the center effectively with limited manpower.
Níbí báyìí, àwa tá jẹ́ clinical worker, ṣé mọ̀ pé àwọn kan wà tó jẹ́ pé irú àwọn lab, irú medical record. So we have one medical record, we have one laboratory technician. So all of that we are just for. Gbogbo wa pátá jẹ́ 6, but bí àwọn yòókù ṣe sọ, bẹ́ẹ̀ làwa náà ṣe. Àwọn adọ́kì wà ń bí, then a ní àwọn volunteers. Tẹ́pá wò sí London scheme kankan tán kàn wá pé káwọn ràn wá lọ́wọ́.
Investigative finding of a systemic failure. Venturing deep into rural areas reveal a stark reality at Saja Isale Ora Primary Healthcare in Ogbomoso and Ayete Primary Healthcare, Ayete Town, where severe staffing shortages are palpable. Mrs. Adetoye Fumilayo, the sole government staff worker at Saja Isale Ora Primary Healthcare Center, highlighted the strain on resources.
3 cities, morning, afternoon, and night. Altogether, I want to train staff, there are 5. So I want supportive staff, and I don't feel how I'm laying. I want maybe I want basic. All I got to get enough for actually okay, plus me. Supportive work, let me get double sick in one shape. Much money on if you're going to 5 or 6.
At Ayete Primary Healthcare Center, the recent death of a government staff member who replaced a retired matron has exacerbated the critical understaffing crisis. In Ibadan, Mrs. Abiade Omobolanle, officer in charge of Adifashe Primary Healthcare Center, appeared visibly fatigued after attending to over 50 pregnant women during the weekly antenatal clinic.
That's 2 staff, and we are doing 3 shifts from 8:30 to 6:30 for good 3 weeks. Past 3 weeks, me off from Monday to Sunday 3 weeks. Yes. Basic gba méjì fún wa, basic health gba méjì tán sanwó. Àwọn lọ́mọ 2 days la fi ṣe rérò pọ̀ over 100 lọ́mọ wa.
Highlighting further challenges, researcher Dr. Bakari Kende disclosed instances where volunteers in primary healthcare centers refer patients to private hospitals for a commission, undermining public healthcare efforts. Despite this crisis, residents in Ayete, Ologunẹru, Eleyele, and other communities admitted that men and women visiting primary healthcare centers for various ailments remain largely unaware of the staffing issues. This sentiment was echoed by patients waiting for their turn, who expressed surprise upon hearing about staffing shortages, assuming all personnel were full-time government employees. Further complicating matters, the absence of resident medical doctors at the visited primary healthcare centers was noted, with an ad hoc staff member indicating that a single doctor services multiple centers weekly.
Doctor doctor to cover gbogbo Ìdó health center. Wọ́n dẹ̀ lè para wọn. Ó lè jẹ́ ẹ̀kan ló máa kàn wá ní ọ̀sẹ̀ àbí ẹ̀kan ní ọ̀sẹ̀ méjì.
The extent of the manpower crisis becomes most apparent during immunization and antenatal service days, contrasting with quieter days when few residents seek treatment for general ailments. Mrs. Oluwakemi Afolarin, a patient at Ologunẹru Primary Healthcare Center, voiced her concern over inadequate staffing.
I know most of the workers here, they are hard work. So I think government should find solutions to that.
Moreover, a significant number of pregnant women who attend antenatal services at primary healthcare centers across the state ultimately opt to give birth at private hospitals, undermining efforts to reduce maternal and under 5 mortality rates. Addressing these challenges, Mrs. Jokotola Olayemi Eniola, a Ward Development Committee member in Ibadan Southwest, emphasized the urgency of addressing maternal health care issues. At a recent training session organized by the Justice and Peace Commission, Ibadan, Eniola urged the Executive Secretary of OISHIA, Dr. Debo Akande, to address the rising mortality rates among women delivering with.
Here is
105.5.
Accessing 105.5. One station, all the hits.
105.5.
Our community, Oyo State maternal mortality rate is 262 deaths per 100,000 live births annually, according to the 2021 Multiple Indicator Cluster Survey and National Immunization Coverage Survey released in August 2022. While this figure is lower than the national average of 576 per 100,000 live births, it remains alarmingly high. The Multiple Indicator Cluster Survey, MICS-6, conducted by the National Bureau of Statistics in collaboration with United Nations International Children's Emergency Fund, UNICEF, identifies several contributing factors. In terms of infant mortality, reports say Oyo State ranks third with 40 deaths per 1,000 live births, placing it behind Ogun State and Ekiti State, 67 deaths, but ahead of Lagos, Osun, and Ondo. The under 5 mortality rate in Oyo State is also significant, with 57 deaths per 1,000 live births. This rate is higher than those in Lagos and Osun, but lower than Ondo, Ekiti, and Ogun. I also found out that these statistics highlight ongoing challenges in maternal and child health in the state, stressing the need of targeted intervention and improved healthcare infrastructure. Gaps and progress of BHCP Fund. Established under Section 11 of the National Health Act, the Basic Healthcare Provision Fund aims to improve access to primary healthcare across Nigeria. In Oyo State, the initiative led by agencies like the State Primary Healthcare Board initially intended to reach 45,000 individuals. However, as of May 24, 2024, Dr. Olushola Konde, Executive Secretary of Oyo State Health Insurance Agency, OISHIA, confirmed that 213,000 residents have been registered under the health insurance scheme. Mr. Akintayo Fashida, Deputy Enrollment Officer at OISHIA, reported that since the program's inception in 2021, over 80,000 individuals have been documented under the BHCPF in the state. Despite these efforts, awareness and enrollment among vulnerable groups remain low. Many pregnant women, nursing mothers, and economically disadvantaged individuals are unaware of their eligibility for free health services under the BHCPF. Mrs. Oluwakemi Afolarin, a nursing mother at Ologunẹru Primary Healthcare Center, expressed surprise upon learning about the program, underscoring the need for improved outreach and education.
I don't know about that. 0 to 5. I don't know about that.
At Adifashe Primary Healthcare Center, Mrs. Abiade Omobolanle noted the challenge of maintaining continuity in coverage with few pregnant women currently enrolled due to recent births exhausting their health package. She highlighted efforts to engage OISHIA for enrollment but cited delays in response.
Children number 5 were common, adults local. Torí most of them were 5. I want to share enrollment kan. So mo dey sọ fún pa àwọn tó wà megba ẹ ti bímọ. Wọ́n wá ní kíní kan gbọ́mọ wọn wá sí secretariat. Kan wá rí enroll. So mélòó mo dẹ̀ dámọ̀ mo dẹ̀ sọ wọ́n pé ṣé bá wọn láwọn lè padà wá mi. So ọmọ pé olóyún òkè pẹ́ títí wọ́n máa ń yá ju àwọn eléyìí lọ.
These insights reveal both the potential and current limitations of the BHCPF in Oyo State, emphasizing the importance of proactive outreach and streamlined enrollment process to maximize its impact on public health. Staffing in facilities fall short of standards. The National Primary Healthcare Development Agency outlines comprehensive staffing guidelines for primary health facilities, stipulating a minimum personnel requirement per political ward. Each facility was ideally stipulated to have one medical officer accompanied by a community health worker, 4 nurses or midwives, 3 community health extension workers, 1 pharmacy technician, 1 junior community health extension worker, 1 environmental officer, 1 medical record officer, 1 laboratory technician, and supporting staff including 2 health attendants, 2 security personnel, and 1 general maintenance worker. However, a stark disparity exists between these standards and the actual staffing observed in the field. To further investigate the Oyo State recruitment policy and primary healthcare employment data, I contacted the Executive Secretary of Oyo State Primary Healthcare Board, Dr. Muideen Olatunji. The doctor emphasized that, according to set standards, Oyo State PHCs require at least 14,000 medical staff to function effectively and meet the healthcare needs of its citizens. However, he revealed that PHCs across Oyo State currently operate with less than 5,000 personnel, highlighting a significant shortfall and the root cause of many issues.
Well, Primary Healthcare Board, we have done our own minimum service package and gap analysis. And in that gap analysis, we've been able to understand that from what is required, if we want to have a qualitative standard healthcare service delivery, we need to have well over 14,000 personnel. But as we speak today, we have less than 5,000 personnel. So that means there's a huge gap that we have. So we don't really have what is required to provide the service, but we are working towards that set goal with the idea and the innovation that we have to get things done.
Despite the intervention of the BHCPF and other programs aimed at improving healthcare access, the impact has been minimal due to severe staffing shortages. Dr. Olushola Akande, Executive Secretary of the Oyo State Health Insurance Agency, acknowledged the impact of these problems on service delivery and stressed the need for patient-friendly care.
There's shortage of manpower across the globe. Even in the US, you have unemployment rates. You have gaps, in their various facilities. Why is it that a lot of people, are jackpine? Is it not because they are making demand, abroad? They have a lot of spaces to fill, and they don't have enough people to fill it. That's why people are running away, so they are making advertisement, come. So you always have gaps everywhere. The question I ask is this: if I have a private, so I identify with it. Okay. Do you understand? So I'm not saying that it's a fallacy. I'm not saying that it's a mirage. Those challenges are there. But what I'm saying is, we can still have some level of optimal performance, even with those challenges.
Similarly, Dr. Muideen Olatunji, State Executive Director of the Primary Healthcare Board, confirmed the staffing shortage but assured ongoing efforts to address it, citing retirement as a contributing factor. Dr. Muideen Olatunji, in a recent disclosure with journalists, confirmed that Governor Seyi Makinde has so far approved the recruitment of 30% of the personnel needed for the state primary health care to function properly.
This has been a cumulative challenge that we have. At the current situation, with many people say retiring, the pressure is on the primary healthcare sector.
We've been able to advocate to the executive governor of the state, who has gradually approved that we know the economic situation we have in the country and what it takes to even engage personnel. And the enrollment of healthcare workers is very huge. So he has gradually approved that 30% of our need should be recruited now, and which approval has been granted.
More insights on the development. I also spoke with stakeholders who identified the lack of large-scale recruitment since 1992 as a root cause of current issues. Mrs. Grace Ademidun Oluwatoye, A retired nurse and midwife suggests engaging retirees and adopting successful models from countries like Brazil to improve access and service delivery in primary health care.
I think what government needs to do in Oyo State, engage more of people with related experiences. For example, the non-governmental organizations, civil society organizations who are health-related can be engaged as third-party monitors. Some countries have done this before. Brazil did that and was able to achieve 98% coverage of the universal health according to the WHO mandate.
Dr. Dixon Adeolu Adetoye of the APIN Public Health Initiative highlighted the staffing shortages effect on user fees, service hours, and patient outcomes. Mr. Jide Bangboshe from the Justice Development and Peace Commission, JDPC, Ibadan, urged the state government to prioritize healthcare delivery at primary healthcare centers, which are closest to the people, by addressing the long-standing vacancies in health personnel. Similarly, Mrs. Gbadamosi Adenike, the new officer in charge at Eleyele Primary Healthcare, emphasized the need for a fair and merit-based selection process. Gbadamosi said there was the need to re-emphasize the importance of recognizing the contribution of dedicated ad hoc staff who have served at primary healthcare centers for many years. This report was made possible with support from the International Budget Partnership, IBP, and the International Center for Investigative Reporting, ICIR.
We've got the city on lockdown. Got my own city that I hold down. We are Splash 105.5.